And, we talk about mortality a lot, but for every one death for maternal health, there is always about 60 or 100 morbidity. And there are some of them that are so near death that it sometimes leaves psychological memories for those women, for those people of color that do go through that, and women generally, and birthing persons as a whole. Even for college educated women, even for women with high income, they still go through challenges, and these disparities when they are accessing care for maternal health. A very good example is the story about Serena Williams recently. For goodness sake, she's an athlete. She's rich. She has all of these privileges that she has, and I'm not, you understand what I'm saying. And she's not
Of
limited
course.
by some of these resources. Um, but she still had a near death experience at the point of care while, in this process of childbirth.
Hello, I'm Sheena Gill, President and CEO of Americas for CognitiveCare. Today on our podcast, we are thrilled to feature Dr. Bilikis Oladimeji. Dr. Oladimeji serves as Senior Director, Clinical Informatics and Innovation at the Center for Advanced Clinical Solutions at OptumHealth. Her current role at Optum focuses on developing solutions with clinical care teams, emphasizing a user-centered design and approach, and focusing on the quadruple aim in healthcare. She also works to advance efforts to improve maternal health equity, STEM, and the health workforce through executive sponsorship roles, work groups, and volunteering. She obtained her medical degree from the University of Lagos and a Master's of Management in Clinical Informatics degree from Duke. Welcome, Dr. Oladimeji. We're very pleased to have you on the show.
It is my pleasure, Sheena. Thank you for having me.
Absolutely. So, why don't we start off by having you share more about your role at Optum and your aspirations for the vectors that you lead?
Thank you so much. Yeah. So, like you said, and I really appreciate your wonderful intro and reading off that bio. I work at Optum, like you said, and I've always been interested in making sure that we help our clinicians at the point of care. Being a physician myself, I understand some of the challenges that clinicians face and the healthcare workforce as a whole face when having to help patients at the point of care. So what we're trying to do is bring evidence a lot more closer to them and utilizing technology in a way that helps them to augment their efforts in serving the patients better. So our team currently focus on more of clinical decision support tools and platforms that enable clinician get that evidence-based information very quickly and be able to practice at the top of their license, and also ensuring that they're personalizing the care that is being provided to patients. So at the end of the day, all of the goal is to ensure that we meet that quadruple aim of reducing cost of care, improving the experience for clinicians and the healthcare workforce, making sure that we provide quality care to patients, and all of the different nuances there.
Wonderful. So, you are a leading voice as a physician innovator and an informatics expert, and you are famously quoted over and over for having your three things being education, health, and equity. I would like to know what has inspired you along this journey, and how have these three things in particular become front and center for you?
So it's a wonderful story, but I think I'll begin from the very, very far end. Like you mentioned, I immigrated to the US in 2012. I'm originally from Lagos, Nigeria, and I think from the very forefront of my background and how I even became a medical doctor in Nigeria all lied within that point of being able to the intersection of all of these pieces, that the three things that you mentioned. And I think a lot of it also came from being able to include my personal belief and my personal experience to infuse that into my personal mission, which I don't talk about that often because it continues to evolve over time. But the things that I know that are very central to that mission has always been health, education, and equity. But a recent event was what actually made me bring that out and start to put that in my profile and continue to say that. I had this interaction with Mr. Michael Akinleye, who was the CIO for the VA systems at some point, and we were having this conversation, and he was talking about his three things, and that made me just realize that yeah, that's actually a good way to frame and be able to be focused on the things that are central to one's lenses and the way that one looks at things. So again, the inspiration for that has been my journey from a young girl living in Lagos, Nigeria, who education became the reason why I'm here today, who has loved healthcare and caring for people for a very long time, and has always been very fascinated and interested in ensuring fairness across the nation, across in the society and everywhere. So it just made a lot of sense to be able to pull through those threads from both my personal and my professional life, and my innate desires to reflect on several of the things that, several of the experiences that I've gone through, to come up with those three things that really matter to me. And today, honestly, it is a great conversation starter. It makes people know what my areas of focus and interest is. And with that, it makes it easier for me to talk about my mission, which is, as of today, is helping people to be the best of themselves through education, through those things, those three things still, and making sure that I put the lens of equity in a lot of the projects that I work on, putting the lens of education and professional development in the way that I interact with people that within our organization. So the employees, or even people that I interact with on a day-to-day basis, whether through advising or mentoring, just helping them to see that deep-rooted need for continuous learning and education and professional development. So those three things are really core, and they are part of my professional and personal life, and realization and reflection on all of those things.
That's so inspiring, and it makes me feel that perhaps we should all have our three things. And so thank you for sharing that.
I
So,
think so.
yes, indeed, indeed. So, switching gears just a little bit, at Cognitive Care, maternal health is something that's very core to our mission. And so, I wanted to ask you a question about some work that you're doing and supporting. So, I understand you have an important role with the Morehouse Centre for Maternal Health Equity, a grant there. And please share with our audience why this research is so important.
Okay. So
Go ahead.
at this junction, I wanted to quickly mention that the ideas that I share, or the thoughts that I share here, are my personal opinion and are in no way representative of my organization, Optum and UHG. So, to your question, as part of my work in Optum, I have had the pleasure of being an executive sponsor for one of our Optum CSR grantees, which is Morehouse Centre for Health, Maternal Health Equity. And through that, the funding was about a research that is being done. And I want to give a shout out to Natalie Hernandez, who leads that center and is the director for the center. So what the work or the study is focused on is, how do we bring the experiences of people of color to the front and be able to conduct a narrative based research that puts their experiences into, that brings it into light. And so what we did was, we recruited these women across the different places in the US, with particular interest in areas where there is low maternal health outcomes, and we got to hear from them, sharing their near miss experiences, which is their experience that did not result in death, obviously, but it brought them close to death, and that is something that happens between, maybe during their pregnancy and 42 days after their delivery. So we wanted to understand their experience to be able to inform the knowledge that we have across the world, I mean across the nation, in dealing with some of the peculiarities around disparities that people of color face when going through the birthing journey. So it's been a real pleasure to be able to do that, and we've gotten different lessons out of that. And some of that information that we are getting, the analysis is still in progress. But interestingly, because of how important this is, it is already contributing to policies in Georgia. It has been used at the CDC. Some of the stories that were aired, of course, we got permissions from the women to share their stories. They have been used within the CDC Here Our campaign, and some other presentations around maternal health and how we can help to solve some of the challenges that abounds today relating to maternal health in the country. As you know, within the OECD countries, the US does the worst when it comes to maternal health, but there is hope for us to be able to reverse that cycle and be able to do things right. And so I'm really excited that, to be part of this research in partnership with the Morehouse Centre for Health, Maternal Health Equity.
That sounds like amazing, amazing work. And I think everyone out there who's listening should take a look at what you're doing. I think it's very important. I think what
Absolutely.
Morehouse is doing is very important.
Absolutely.
Indeed,
Please
indeed.
check out their website and look out for we will hopefully be disseminating the result from that piece very soon. So look out for that, learn a little bit more about near misses. And we talk about mortality a lot, but for every one death for maternal health, there is always about 60 or 100 morbidity. And there are some of them that are so near death that it sometimes leaves psychological memories for those women, for those people of color that do go through that, and women generally, and birthing persons as a whole. So I think there is an opportunity for us all to learn from those experiences and from those narrative based research, whether the ones that we're doing with Morehouse or even some others that you might be able to find out there.
Thank you. Thank you for sharing that. So, more on maternal health. I guess I had an additional question. To improve the state of maternal and infant health in this country, we know that structural racism and social determinants need to be addressed as part of designing any solution that is going to have impact. And, also relevant to this concept is the issue of trust. And so, how do we hold our partners accountable, these partners in the healthcare ecosystem, for equitable change? And I was also curious, given your unique interdisciplinary background, what role, in your opinion, does informatics and data play as it relates to building trust?
Thank you. I think you have like multifaceted questions in that one. But as a whole, I think it all starts from us acknowledging where we are. And one of the things that helps us to acknowledge where we are is data. But the challenge with the data that we have currently is that sometimes we have inadequate data, incomplete data, data that doesn't even put itself in the context or even give us or show us the context in which it is being collected, in which several disparities are being sort of not being truly defined. So it becomes very important for us to not only look at quantitative data, but also pay attention to qualitative data, which is one of the reasons why we took that narrative based approach. And you talked a little bit about the disparities as well. It's out there in the open. We all know that people of color, Black women especially, have 3 to 4 times more maternal deaths compared to their white counterparts in the US. And sometimes that doesn't even have anything, a lot of it is, some parts of it is due to the socioeconomic challenges. But one of the things that has also come out from storytelling and from narrative based research is that even for college educated women, even for women with high income, they still go through challenges, and these disparities when they are accessing care for maternal health. A very good example is the Serena Williams, the story about Serena Williams recently. For goodness sake, she's an athlete. She's rich. She has all of this. She has all of this privileges that she has, and I'm not. You understand what I'm saying, and she's not
Of
limited
course.
by some of these resources. Um, but she still had a near death experience at the point of care, while in this process of childbirth, which is just it just brings up the need for us to be a little bit more um concerned in learning and listening and making sure that we're really getting to the roots of the challenges that we have. Again, like I said, the social determinants of health is definitely a contributor. But in some cases, to the point that you made, structural racism definitely exacerbates the challenges that the people of color, Native Americans, and Hispanics sometimes face when it comes to this to childbirth, and it obviously shows within the maternal and neonatal indices that we look at. So it becomes very important for us to pay particular attention not only to what the data is telling us, but also the experiences and the lived experiences that's been shared by birthing persons across the nation. And to your point about what technology can do, I think there is so much that technology can do in enhancing the experience of birthing people across the nation. It helps us to be able to, there's several ways that we can leverage technology to improve the experience of people. We can also use technology to drive the use of evidence-based medicine, such as the CD, talking about clinical decision support, for instance. Informatics can help in that way, and technology can help in that way in making sure that care is a lot more personalized to the people that are interacting with it. And because of the capabilities of, the strong analytics capability, the strong technology capability we have the opportunity to be able to ingest data from several different sources. And that is not, whether it's structured data, whether it's unstructured data, we have the ability to take all of this information and process it in such a way and make it available at the point where it's really needed, whether it's at the point of care in front of an healthcare a worker, whether it's in the community, whether it's the direct consumer information that can enable all of the different parts of the childbirth process, whether it's prenatal, whether it's during labor, whether it's postpartum, all of the different segments. There is a central role that technology can play, just like it does now in our daily lives with shopping and entertainment and several things. I think there is a big role that it can play in facilitating the right care to the right person at the right time and enable us to get to better maternal health outcomes, as well as better child outcome, or child outcomes.
Absolutely. Amen to that. I totally relate to all that you just said there. And I feel that with leadership such as yours, and the work that you're doing, we're making progress. I know it's going to take time. But you're right. It starts by sort of recognizing what needs to be done, and accepting that and moving forward and putting all the pieces together to make it happen. So, I wanted to switch gears here just a bit. So you recently co-authored a chapter in an informatics textbook, Nursing Informatics, a Health Informatics Interprofessional and Global Perspective. And, as you well know, as you just described, we are really in a desperate shortage of nurses, and it looks like we're on the cusp of an additional wave of nurses leaving the practice. So I was curious, specific to nurses now, and from a informatics perspective, if you will, what can we do to improve nursing burden? And I completely respect and understand, the issue and the very serious situation we have with physician burden. But I also think it's important to recognize the reality of nursing burden. So, given that you just wrote this really important, chapter, curious for your thoughts on that.
Yeah, so my chapter in the nursing informatics book was focused on interdisciplinary or interprofessional relationship around informatics, and using Nigeria as a backdrop. But like you said, the primary focus of the book is education and also empowering leaders, within the healthcare setting, especially nurses, to embrace informatics and to see it as an opportunity to make lasting changes in the way that care is being delivered. And you've said it very well. And I mentioned it briefly earlier. The shortage that we see and the reluctance of people to want to pursue nursing careers is very evident, and we can all see it happening around us. There's a lot of stats that's out there about how many nurses are leaving the profession, and how many are already burnt out or at the point of burnout. And it's sad to hear that, because nurses serve a central role in the care of patients. I have been a patient before, and I absolutely appreciate the care that I have received from nurses. I've also had, as a physician, I've had the opportunity to work with nurses in a professional setting as well, and I recognize all of the efforts and all of the work that they contribute in as part of the medical team. So it becomes very important for us, again, to the point of aligning incentives, like we talked about earlier. We need to appreciate the importance of the role of nurses in the care ecosystem, and we need to make sure that we are creating an environment that is helpful for them, that sustains their energy to be able to even do more, and satisfaction as well. So I think with informatics gives an additional opportunity for nurses to not just be observers but also participants in the creation of the technologies that enables them to do a lot more. So serving themselves, I have very great nursing informatics friends that just seeing how they approach care delivery is fascinating. And in the world that we are in today and the future as well, technology is going to play a central role. So we do need nurses that have a collection of skills that would include caregiving as well as technology and informatics knowledge, so that they can be able to walk through whatever electronic medical records would look like in the future. They should be able to interact with them. And so again, central to this is going to be listening, and trying to understand where the pain points are for these nurses, and creating the technologies with them that will enable them work
Right.
a lot more better and ease the burdens that they face at the point of care, and make it easy and enjoyable for them. Same thing applies to physicians, like you referenced, like the
Right.
physician burnout is something that a lot of people are working on as well. I think central to that is some of the documentation burden, and all of the different ways that we can bring all of the, whether it's AI and machine learning, whether it's natural language processing, whether it's several application of different technologies to enable us automate some of the processes, to free them to be to free nurses to be able to do other things that only them can do in the setting. I think it becomes important for us to make sure that is the case, and we focus on that and align in solving those challenges and making it easier for nurses to practice, and for them to be able to be satisfied, and even be able to encourage some from K through 12 and college students into the fold.
Absolutely spot on. I think a lot of people are going to resonate with your comments just shared. So, Dr. Oladimeji, thank you so much for your time and for sharing your incredible insights and your interdisciplinary wisdom. Any last thoughts that you would like to share?
Yes, absolutely. And, first of all, I wanted to say thank you again for having me here, as just a human with different experiences within the healthcare system, whether as a patient myself, which is also one of the drivers and one of the inspirations for me, going into the informatics field, and taking this path that is not typical after medical school. Um, I feel like we all, as collectively, have a role to play in creating an healthcare setting or an healthcare institution industry that we all feel proud to be part of, and do not, feel like we don't have to be afraid when we have incidents or reasons to actually show up for care. So whether it's the annual visits, whether it's something that needs to be treated, we want to make sure that we're working together to create an ecosystem with it of health, that is better serving to everyone, regardless of race, gender, color, ethnicity, regardless of anything that is out there. We want to also make sure, as innovators and creators and informaticists, that we're putting in all of the things that we're creating, in the analysis that we run, in the technologies that we build, in the solutions that we create. We are always asking, who are we leaving behind? You know, along the course of this conversation, we've talked about the rural setting. Um, and one of the challenges, one of the barriers is the broadband access. So whenever we're creating solutions and we're using the technology to drive some of the activities we do, we need to make sure that we also keep in mind those that might not have access or the know-how of the technologies that we're putting out there, and ensuring that we're creating a plan to cover them as well, because no one deserves to be left out. You and I wouldn't want to be left out, and it's just important for us to create an health system that is better serving to everyone, regardless of where they're from, what they do, where they live, where they sleep, all of those types of where they work. It's very important for us to make sure that we're creating a health ecosystem that's helpful for everyone. And some of the thoughts that I wanted to share as a final is also the fact around making sure that we recognize that availability or even insurance doesn't necessarily imply access. So that helps us to make sure that we're avoiding that blindsiding. We want to make sure that technology is an inclusive tool, and it's a tool that we make sure that we're using to address inequities as best as possible. I would like to re-emphasize listening again, because a lot of us, whether we want to believe it or not, we have our unconscious bias based on the privileges that we have, based on and just advantage that we might have, which is not a bad thing, by the way. It's just a matter of our side, our side of the story, or our side of experiences. But it's in the course of listening that we get to step into the shoes of others. That's where we are able to get that empathy that enables us to see things from other people's perspective and be able to, um, create solutions that would help to fill gaps that they might have in anywhere that whatever we do. We need to make sure that we're reinforcing diversity, equity, and inclusion, as well as accessibility. Sometimes we forget, but we need to make sure that that's at the top of our forefront. And I think, with some of those, and just a general dedication to doing better, I think we can all do great things that would have ripple effects in the healthcare ecosystem.
Fabulous. And we can certainly see that dedication all throughout you. You have given us so much to think about and so much to act upon. Thank you so much once again. To our audience, we hope you enjoyed this episode with Dr. Bilikis Oladimeji. And until next time, be well.